Hey everybody, my name's Ashley, and tonight I'll be doing a short lecture on Meniere's disease. Meniere's disease is a condition thought to arise from abnormal fluid in the inner ear. It is a clinical diagnosis associated with progressive sensorineural hearing loss, tinnitus or ear fullness, and episodes of vertigo. These patients have lesions called endolymphatic hydrops that are located in the labyrinth system inside the ear. Unfortunately, these lesions cannot be diagnosed except post-mortem during an autopsy, and these lesions will be noted on the temporal bone. With that being said, patients are diagnosed with Meniere's disease on clinical presentation alone. Who's at risk? Any age, but typically patients between the age of 20 to 40, females greater than males, and Caucasians greater than African Americans. So how do you diagnose these patients? According to the American Academy of Otolaryngology and Head and Neck Surgery, they state that patients have to present with 3 symptoms. The first is 2 or more episodes of vertigo lasting longer than 20 minutes, tinnitus or ear fullness, and then the third is audiometric confirmation of sensorineural hearing loss. With the vertigo, the patients need to understand that it is a sensation of spinning or rocking. You need to ask these patients, when did the vertigo start? How often is the vertigo happening? How long does each episode last? With the hearing loss, you could perform a Weber and Rhine test or a whisper test, but you could also ask the patient, have they noticed anything with their hearing that's different? If a family member is present in the room, you could ask the family member, have they noticed anything? Have they had to repeat themselves several times to the patient? Have they noticed them listening to the TV volume higher or music in their car higher? And with the tinnitus, you need to ask the patient, have they been experiencing any ringing in their ears, any pressure noted in their ears, any ear fullness that they're feeling? It would be a sensation that would come on usually once the vertigo starts happening. Once these patients have been diagnosed, how do you treat them? Well, the first you're going to do is you're going to refer the patient to an ENT. The audiometric confirmation of the sensorineural hearing loss is performed at an ENT's office. These patients need to be constantly seen by the ENT to monitor the progressive hearing loss that will continue to happen. As a nurse practitioner, our job is to manage the vertigo, the frequency, and severity. You can do this in several ways. There is no gold standard of treatment for Meniere's disease. You will 90 to 95% of these patients can be managed with vestibular suppressants and can go on with normal daily activities. Benzodiazepines, lorazepam, is one way to manage these patients. Another way is anticholinergics, that would be scopolamine patches. And another way is antihistamines, that would be meclizine. Now, there's other drugs in these classes that you could use. That's why there is no gold standard of treatment for Meniere's disease. There's several ways that you could go about it. Some ENTs prescribe diuretics to these patients to decrease the endolymphatic pressure and volume. Lifestyle changes. They need to decrease and limit their salt intake in their diet. They also need, if they're smokers, they need to quit smoking. Limit alcohol intake and caffeine intake. All of these things can increase the severity and frequency of the vertigo attacks. These patients, as far as education, needs to know that this is a chronic disease and there is no cure for it. There's only treatment of the vertigo. They need to keep up with their appointments and make sure that they are attending and letting us know if there's any changes in the frequency and severity of the vertigo so we can change treatment options. Hearing loss is progressive. They also need to know that the severity and intensity of the vertigo does decrease over time. And that's it for tonight. Thank you.